our guests, so I'm just going to jump right in to some brief bios and introductions. Kirsten Bolton, an LICSW, has been working with patients and their families in the Center of Excellence in Psychotic Disorder at Harvard's McLean Hospital. She was the program director of McLean on Track, a first episode psychosis program for young adults, and is now the program director for Appleton House, a recovery-oriented residential program on the McLean campus for those diagnosed with psychosis. Next, we have Rachel Vogel. Rachel is a licensed clinical and forensic psychologist who has worked extensively with culturally and diagnostically diverse populations in both New York City and Colorado. After completing predoctoral internship at Bellevue Hospital, Dr. Vogel led a mobile-based mental health team designed to help individuals living with complex mental health and legal needs lead sustainable lives in the community. She is also the director of Brooklyn Mind's Winnicott Community Program, which is founded on relationships. Next, we have Dr. Stephen Geiszler. A graduate of NYU School of Medicine, he is board certified in adult psychiatry and currently works at Brooklyn Mind's as a psychiatrist. He was also the physician in charge of the clozapine treatment clinic, a program he helped to develop in 1992, a true pioneer there, and continued to lead and expand through 2019. In addition, he directed the long-acting injectable clinic for many years. Last but certainly not least, Doug Lehrman is the Chief Operating Officer of Brooklyn Minds and is a passionate and man full of service who truly cares about developing disruptive solutions to the healthcare system. He has 25 years of experience founding and building all operational aspects of healthcare and wellness companies. In addition to his professional experiments, Doug has also been deeply involved in caregiving for a family member with chronic mental health complexities. Thank you, guys. I'm so happy to be here. So when I kind of sent this panel out to my family and friends, I had some people come back to me and just ask, like, oh, I'm so excited, can't wait to be there, but what is psychosis? So in case there's any one of those people or someone else who doesn't know what psychosis is, Rachel, can you just give us a brief definition of psychosis?
Yeah, sure. So psychosis is a condition that affects the way that the brain processes information. It's a state of mind where someone loses touch with reality, but for that person, it very much feels real and true to them. When someone is experiencing symptoms of psychosis, they may see, hear, or feel, or believe things to be true that aren't really happening in reality. And psychosis is also it's a symptom, it's not an illness, that it's a symptom that's found that is associated with both mental health and medical conditions.
Thank you. So we have a poll going up and we'll have one at the end just to kind of gauge the audience. Do you know someone struggling with psychosis in this pandemic? So you can feel free to answer yes or no to that. And does anyone else have any kind of personal add-ons to Rachel's definition of psychosis? Good. All right. So then we're going to just jump right into Doug's unique perspective as a caregiver. So Doug, what has it been like emotionally and personally for you to take care of a loved one affected by psychosis in this pandemic?
Well, it's always challenging to take care of someone close to you with psychosis, but during this pandemic, it has been made much more difficult, both because of distancing. I've gone through COVID and obviously had to spend quite a bit of time away at home and separate from my loved one. And in addition, my family member experienced more loneliness and lack of structure in their day as a result of everything being shut down. So the combination of distance from family and lack of structure has made it extraordinarily difficult.
I'm mute. Sorry, thank you for that, Doug. And that kind of leads us to kind of some of our next more practical questions. Kirsten, can you explain the importance of human contact in psychosis and kind of how this pandemic is affecting that?
Sure. You know, I want to say that one of the most profound, I think, ways that I've been able to help individuals with psychosis in the years that I've been working with this particular population has really been to make that human contact and to really help individuals who would tend to want to isolate more, be able to establish trust with me. And I feel like now, like, kind of trying to maintain relationships over Zoom and maybe even just over the phone has been incredibly challenging for the majority of individuals that I'm working with. Where, like, sure, there's still a voice on the other end and there's still someone kind of, you know, on the screen, but it's just not different. That space, you know, between one another is just not there. That energy is not there. And I think it's been profoundly difficult for many people that I've worked with.
Yes, thank you. I mean, it's difficult, I think, for even all of us.
Right.
Steve, can you tell me what specific risks exist for people with psychotic disorder in this pandemic? What maybe additional barriers or things that are exacerbated we should be aware of?
Yeah, I think, and getting back to what Kirsten highlighted, the issue of being socially distant. In a lot of ways, many patients who suffer from psychosis, and particularly, I guess, the most common psychotic illness is schizophrenia. They often are already socially distant in a lot of ways because very often they are kind of marginalized in society and don't have the same degree of contacts, the same support networks that the general population might have. So they're very dependent upon their caretakers, their therapists, their supervisors, and whether it's at work rehab programs or the clinics they go to, the clinicians that they see. And not having all those supports really makes them even more isolated than they are before. So it really creates, you know, even more barriers. It's also harder for many of them to be able to reach out. So, you know, many of us have been practicing telehealth, but for very many people who have psychosis, they don't have the means to have computers or laptops to have Zoom calls. So at most, many of them are just depending upon a phone call. And it's really harder to get and make a connection to people who just have, you know, contact with audio, because you can't pick up on some of the subtle signs that people have if they're beginning to not feel right, they're not looking right. And it makes them more vulnerable to having exacerbation of their illness. The other thing is, I think, you know, we all are under some state of anxiety and some degree of depression. But for people who have a psychotic illness, those kinds of stressors can increase the likelihood of having a relapse or an exacerbation of symptoms. And at a time where it's a lot harder to, you know, come to your, you know, physician or your social worker, your psychologist, it really makes it harder to kind of detect if someone is having an issue and to get the help that they might need.
Yes, thank you. And, you know, one of the things as I was speaking to my friends in the psychiatric emergency room in New York City, they were saying, you know, having a psychotic disorder also puts you at risk for getting COVID-19 because you have a hard time following the rules of social distancing. It's very confusing to be told to stay in one place and to not touch. And, you know, as we know, with psychosis, it's hard to do that. So we're going to jump to some of our questions. And for participants, you can go down to that little Q&A box and type in your questions. We have 3 now. So what triggers psychosis? Specifically, what about social distancing during this pandemic? So this kind of plays into the touch. Is there anything else you guys are seeing?
I mean, when I think about factors that could trigger a psychotic episode, I think of environmental factors, so things that are happening in someone's environment, interpersonal stressors, as well as any psychosocial stressors, and then most notably, like also someone's ability to sleep at night. And if they're losing sleep at night, for some of my clients, it makes them quite vulnerable to experiencing some of those symptoms.
I would add to that, and I would say that medication management and breaking all of your norms of what you're experiencing and how your day is no longer structured translates further into medication management. And so medication adherence can decline, which would exacerbate psychosis and some other factors.
Yeah, I think going back to what Rachel had said earlier about what psychosis is, I think very often there's some people who suffer from psychosis where they're kind of in and out of reality. And they depend upon the usual signposts of everyday life, contacts with people, friends, relatives, clinicians, who can kind of help ground them. And without those kind of anchors, it can lead to becoming more internally preoccupied and more preoccupied with psychotic symptoms.
Mm-hmm.
Yeah, I was saying there was one woman, an older woman that I work with, who was telling me how ironic it was that I was telling her to not go out, like to not leave her house as frequently, you know, like all of these things that we've been working so hard on over the years, and I've been pushing her to do, like, you know, make connections, like talk to people when you're in the grocery store, even like talk to people when you're in the pharmacy. And now I'm like, don't do that. And I think it's really destabilizing.
Mm-hmm. I mean, one of the things I talk to all of my clients about is the role that structure plays in our lives. And I think really with my clients who experience psychosis, structure is really important. And I found that even just little disturbances can really cause people to have significant effects. So something as, you know, serious as the pandemic, like really is changing all of someone's routines that can put them at risk.
And let's say, and this is kind of going back to some of our both audience questions we haven't answered yet. If, like, what does it look like? What should you look for? If a loved one maybe is experiencing psychosis, what should you do, and what does it look like? Because I think we know, I mean, I know as a mental health provider that something as traumatic as this pandemic could actually trigger maybe onset. The other thing that they're seeing in the psyche right now is because of the stresses of the pandemic, a lot of drug-induced psychosis. So maybe Dr. Geiszler, what does it look like?
Well, I think very often, I mean, we'll start with what you just mentioned about drug-induced psychosis. I mean, substance abuse has increased, whether it's alcohol or other drugs, and it really can make psychotic symptoms worse or come out if they've been, you know, under control for a long time. Very often when someone's beginning to have a psychotic relapse, the symptoms they're experiencing are anxiety, are insomnia, feeling moody, unable to kind of, you know, carry on with the regular routines. And since the whole world has been turned upside down in so many ways, it's very disruptive. And, you know, as Rachel said, with not having a regular schedule of events and not having a regular place to go to is very, very disturbing and can make you even more likely to have, like, you know, symptoms. So that you would look for someone who seems more withdrawn, someone who is not calling or FaceTiming or contacting people, feeling more down, or their sleep patterns are more irregular. I mean, all these things are important. Just, you know, just basic day-to-day functioning is I think, the first clue to look into to see if someone's having trouble.
Anything to add from any of our other panelists?
Like a very clear break with reality. So, you know, you're having a conversation with someone and what they're talking about, or, you know, how they are experiencing life on a current basis, you know, has really a no relationship to reality, and you can see it getting, as the days go on, in some cases, you can see that becoming even a greater problem, as well as experiencing grandiosity and so forth. And I think those are some of what I've experienced as a caregiver.
So this question is particularly interesting to me. Do you feel the media is accurately covering the mental health impacts of COVID-19 in quarantine? If not, what would you like to see to help those experiencing psychosis? So, I mean, I can speak again, maybe to prompt this more. Some of my friends at the Psych are talking about the media coverage kind of increasing paranoia, increasing the idea of an enemy, conspiracies. So what are your guys' thoughts? Maybe Rachel, you're shaking your head about the media's coverage.
I mean, to be totally honest with you, I heard this question. I was like, I've not been paying attention to the media. I have so much
fine.
Putting up boundaries to help maintain my own.
That's good.
So I honestly don't really know exactly everything, like the most up-to-date things that are happening in the media right now. You know, my mind was still kind of going back to the previous question and really thinking about, like, if someone was maybe experiencing some of these symptoms for the first time, it can be really terrifying and really scary for them. And sometimes, and people, and it can be really difficult to trust someone with that information. And so to the previous question where, like, what to do if you're concerned about, like, a loved one maybe having symptoms, I think you try to talk to them, you know, quite compassionately, using a lot of empathy and curiosity, no judgment. And if, you know, people are talking about having trouble being able to, you know, just take care of themselves, like get up, shower, brush their teeth, those types of things, are, you know, fixated on the fears related to the paranoia, those types of things, like, you know, alerting their, you know, mental health provider, someone in their life, if they are connected to care, so that they can sort of do a further assessment, because it can be really terrifying for someone who's experiencing that to share those symptoms.
Yeah.
I
Thank
think
you.
Michelle,
Yeah.
sorry.
No, please go.
I was going to say, I think your question on the media was, it's a very interesting question. And I don't know that the media is necessarily the place where that's going to come from. However, I think that people speaking out who are public figures, in whatever way you want to define a public figure, that people will listen, you know, will just gravitate to, whether they be of celebrity nature or sports nature or whatever the case is, music. I think for people who are sitting there and they can hear someone else talking about their own experiences, but in a safe way because they're quote unquote celebrity, or, you know, sort of in a different realm, I think that would be a good way for the media to put some of that out there if those people would be willing to do that.
From what I've seen in the media, and I also, like Rachel, I try not to watch too much of it, but I advise most of my patients not to have CNN on all the day, because some of them say, oh, my parents are in the next room and they're watching CNN 24/7 and they're driving me crazy. And I mean, we need to have a balance. You need to be informed, but you need to not be over-informed, because it really just creates undue anxiety and depression, and everything becomes sensationalized. But that said, I haven't seen much in the media that has talked about psychotic illnesses.
Yeah.
They talk a lot about depression, they talk a lot about anxiety, but I really haven't seen anything talk about people who suffer from illnesses with psychosis and how that's impacting on their care and their symptoms.
Yeah, I was just thinking the same thing. I mean, we're preparing, like, at McLean for this, like, very big mental health surge, like really preparing for it, you know, by like talking about how we're going to increase capacity, like open up new units around the hospital. It's a very real thing that we're talking about, but it is not something I think that is being like publicly advertised, like, so people out there will know, like, oh, you know, there is going to be support for you, like there is going to be like help for you, you know, like we're thinking about this, like this is on our minds. Like I have not, like, I have not come across that information. It feels kind of underground right now.
Yeah, one of the concerns I have is, I forget, either Kirsten or Rachel, you had mentioned the issue of people who are first experiencing psychotic symptoms, who have not gotten help, have not had this beforehand. And it's been found that, you know, so many people, when they first have a psychotic illness, they may take over a year or so before they actually seek out help. I think in the current climate, people are less likely to seek out help. They're afraid to go to hospitals. They're afraid to go to clinics or to doctors because of the safe distancing. And my concern is that, you know, their illnesses can get even worse before they actually get any help.
I think that's a good point. And Steve, could you speak to kind of the threshold? I mean, because there is the threshold and considerations to sending someone to the hospital right now.
Yeah, I mean, that's a very good point, because I think, you know, some units have been actually partially closed down because they're making room for COVID patients. So there may not be as many psychiatric beds available. And a lot of people are not getting to hospitals when they need to. But if someone seems to be in acute danger somehow, certainly if they're, you know, suicidal, or they're not responding to, you know, usual people contacting them, or they just, or you sense that, yes, they haven't gone to the pharmacy, so they haven't gotten their medications, and they're relapsing. I mean, then that would be the time to call 911, or at the very least, encourage them to, if they're in treatment, have them, you know, contact their clinicians to get the help ASAP, or you know, or if the care provider or family member reaches the clinician themselves and say, hey, my spouse and my son and my daughter is having problems, can you please assist? And I think at this point, particularly, most doctors would want to, you know, if necessary, try to keep someone in the hospital, and, you know, have frequent contacts either by phone or by video conferencing, and also to you know, be quicker maybe to increase medication dosages if that is the response.
Yeah, and I think that goes into one of the questions written in. So do you have any particular tips on engaging psychotic patients in telehealth, especially when they're paranoid? So what spurred me going to that one was you saying increasing medication. Would that be a tip? Or, I mean, I think it's very relatable, at least my experience with psychotic patients being paranoid by any camera.
Yeah, I think that's a challenge. And, you know, what you want to do is, you know, try to first check in, see how someone's doing, ask them how it's going, how are they, you know, bearing up to all the changes in the world, and, you know, how are their routines, are they sleeping, and just, you know, try to ask, you know, first, basically their sense of well-being before, you know, going into anything else. And then as you can, ask about psychotic symptoms, and are they taking their medication? Is it helping? I mean, that would be some of the approaches I would try.
I have not started during the pandemic with like anyone new who experiences symptoms of psychosis. So I have been very fortunate in relying on the therapeutic relationship that I have with my clients, and how we've identified more behavioral signs or symptoms of where, and me sort of reflecting back what I'm seeing if I'm concerned with what their state of mind is. But to the, you know, and so I can't answer that question directly, but I would say that if it would alert me if I was able to meet via telehealth, or you know, on video or phone with one of my clients, and then there was fear around doing that, that would alert me that maybe something was going on. But I think that this is one of the challenges of trying to engage someone new, where there is where they're experiencing paranoia, and sometimes it is some of that referential thinking is around cameras. So it is quite challenging.
Yeah, oh, sorry, go ahead.
No, go ahead, please, Kirsten.
I was just going to say that I really wish that I had like talked to someone for the very first time during the pandemic over telehealth, so I could say if this worked or not. But one of my suggestions would really to validate like the fact that that person is sitting there, like kind of gather information about, you know, why they decided to make the leap, to actually schedule the appointment in the first place, to turn on the camera, you know, on their computer, to sit there, you know, like throughout the session, like, you know, kind of what's the history behind that, you know, what had been going on, like leading up until that point, and to really validate, like, you know, how great it is that they've been able to like even take that step, and to try to connect that way, I think might be a good first step.
I think also I would be flexible, and if someone is not ready to have a face-to-face conversation with a camera, then whether it's through texting or whether it's through emails or through, you know, just a regular phone call, until they can become more comfortable. I mean, naturally, it's better to have a face-to-face contact via video. But short of that, you want to meet the person where they're at, where they're able to kind of reach out to you.
I guess I'd also put in as a non-clinician and ask the clinicians even the role of family members in dealing with the person. So in my experience, my very recent experience, I was in close contact with both the psychiatrist and psychologist involved with my loved one, and they were involved with my loved one, but not obviously physically, mostly through phone. And it was the combination of the team, really the three of us, saying the best next step in our own collective judgments. And I obviously could visit this person, my loved one, by walking around outside with social distancing, was to then say, you know, I think we all agree that this is the right thing to do, is to let's go to the hospital and, you know, let's get some additional assistance and put your arm around your loved one. And I'm totally in concert with, you know, the medical team, but it worked. And then immediately within 12 hours of doing that, you know, my loved one said, you know, thank you, I feel so much safer.
I love hearing that, Doug. I mean, I think it just speaks to like how you can really empower someone to make a decision with like the trust of their family members, so that your daughter was able to make the decision to go into the hospital to be safe, and it can be really empowering for the client. So
It was good.
Kind of on that note, what are some ways to interact with, support someone who is actively experiencing psychosis, specifically in the moment or in the short term? Kirsten, you want to start with this one?
Yeah. I mean, one of the biggest things that I think kind of like humans have the impulse to do when they're sitting with someone that's experiencing psychosis is to challenge those psychotic thoughts. But I really don't think that that's helpful ultimately. I think it's really, and it's okay, like you don't want to validate like what the psychotic thinking is, but it's okay to sit with it and to be with it, and you know, to maybe find points of connection, right, that you know that are there and that are available. Maybe that point of connection is around, well, how can we help, or you know, what are the things that you are dealing with that aren't going well, and how can we make that better, but to really not go after challenging the psychotic symptoms.
Yeah, I think that's so true, whether it's during a pandemic or ordinarily. I mean, you don't want to challenge it because the person experiencing it, it feels very real. And for you to kind of deny, no, you're not really seeing that, you're just going to get into an argument. And what I try to do is to kind of identify where are they feeling bad? What's bothering them? Are they anxious? If they're paranoid about a neighbor, well, gee, how anxious are you feeling? Are you losing sleep? Are you not sleeping well? And just try to identify what's hurting. And if you can reach out to them in a kind of empathic human way, and not get involved with discussions about, oh, there are no such things as voices or paranoia or whatever. I think it's a better way to kind of get someone who will maybe then agree to kind of get some help and then form some kind of basis of trust with you.
Yeah, I often found that also, I think, you know, people with psychosis can say very insightful and meaningful and beautiful and poetic things. there's a lot we can learn from what they're saying and how they're perceiving their context. I have a whole journal of just like beautiful insights from when I worked inpatient at Mount Sinai. So the next kind of in line with someone who is psychotic in the moment, could you speak to some specific challenges the pandemic poses for people with psychosis who are on medications that require labs to be monitored regularly, or who get injections of medications? Maybe Steve, this one's best fit for you to start off.
Yeah, I think that's a real challenge. I mean, I think, first of all, looking at injectable medications, a lot of patients are on injectable medications, which they can get either once every 2 weeks, once every 4 weeks. And I think most facilities are still providing those for patients, even though most of the other services are done through telehealth. And it's important to kind of, support them going to those appointments, getting the medications. If they're not, then the prescriber, should see about maybe if they need to temporarily give oral medication out to try to prevent a relapse, because that's a challenge. Now, as far as lab testing, that's a real barrier in a lot of ways. So, for example, I've seen patients, I wanted to start them on lithium, but I need to have basic lab work and continue that. So I've had to prescribe other medications in the interim until I can do that. Clozapine, the medication, which is kind of the ultimate medication for people who suffer from psychosis and don't respond to other medications, requires weekly blood work for the first 6 months, and then eventually someone's on it for a longer time needs every 4 weeks blood tests. So there are facilities that do that. There are some labs that will have a phlebotomist go to the home to draw the labs. There are also devices which we've recently gotten at Brooklyn Mines, where the person can have a finger stick either at our facility, or some people can even get a home version of that, and it gets automatically sent to the clozapine registry so that then they can get their medication. Fortunately, the FDA, for the first time ever, seemed to loosen its regulations about clozapine blood monitoring, that they have allowed it up to the prescriber's discretion, that if a person has been, for example, stable on clozapine for 10 years and their blood counts are okay, well, they can get the medication without having to get the blood test. Because the last thing you want is set up more obstacles for someone to get the help that they need.
Thank you. And Doug, with your family member, kind of what has been your experience in the pandemic?
So with regard to testing and so forth?
Yeah.
Yes. I knew that the medication levels of were absolutely dropping through the floor, because I could see the result of the impact of that, so I'm familiar with what it looks like when it's correct and when it's not correct. And in this particular case, that's also part of the reason why it was so critically important to go to the ER and to be in hospital in order to bring those levels back up. And since you have to titrate them back up, and it's not something you just kind of just take two aspirin, that was a couple of week process, which has yielded very good results coming out.
Yeah, thank you for that. So is a person experiencing psychosis more at risk for suicide than others? Dr. Geiszler, do you have thoughts on that?
Yes, the answer is yes. And if we look at the main psychotic illness, schizophrenia, it's estimated that about 10% of them die by suicide, which is an alarming rate. And usually when it's associated with depressive symptoms, or when there's a lack of connection going from the hospital to outpatient, or a loss in contact of that. So it's a very serious problem that for anyone with psychotic symptoms suffers from, and it's a grim reality that the illness carries.
And Kirsten, do you have any experience kind of with this link?
Yeah. I mean, I the 10% is like so hard to hear, and I know that that's true and accurate, and I can only imagine just kind of what people are dealing with amidst the pandemic, where I think it's been largely suggested that suicide rates are maybe already going up, but are definitely bound to go up throughout this time. So it's a very real concern.
Yeah, I guess in your guys' clinical experience, you know, is there anything we can do to build resilience kind of against suicide in this population? Or
I mean,
Kirsten?
personally, I believe it's the connection and the trust with their providers and their treatment team, caregivers, family members, people around them. You know, so helping the individual feel seen and understood for who they are as a person, not as, you know, their illness or the psychosis that they experience.
Yeah, I was also going to say, I think people don't really sometimes appreciate like how important even the smallest connection can be. And you know, while like we're backing away from those little connections, like in a physical sense, there are like a lot of, I think, creative opportunities out there to kind of create those connections virtually, or like via social distancing. And like sometimes even the smallest thing can make a huge difference.
Yeah, which again is another, I think, barrier to the community right now, right? Because even in the inpatient sense, they're being asked to stay in their room. They can't, you know, in a therapeutic sense, the connection is being lost. So I think it's definitely another challenge. But I do agree that Rachel, and which is kind of the heart of the Winnicott program you run at Brooklyn Minds, just the power and the value of connection. So I appreciate that.
I think it's also critical that when someone doesn't show up for an appointment that's scheduled, you know, through telehealth, call them and be persistent. And if you can't get them, call their family member, reach out to them, so that they're not just so totally isolated and alone.
Mm-hmm. And even if I've had concerns that some of my clients are becoming symptomatic, I'm kind of reaching out to them. If we at Brooklyn Minds will do some texting. And so if some of the things that are happening over text, I may just like reach out to them and call, and just try to connect, touch base, see them face to face.
I think that's so important, what Rachel is saying. And, you know, the three words, you know, from whether it's the clinician perspective or the family member perspective or that team, are trust, validation, and love.
Mm-hmm.
So that's.
I think that's absolutely the heart and soul, in my experience of working with people with psychotic disorder. And I was one of two nurses on my unit who never, and again, not that maybe it is a choice, but who never got violently harmed. And if I had to treat it to anything, it was exactly what you just said. It was my ability and really value of those three things, Doug. So this is one of the last audience questions we have, and I encourage the participants to send in more. So how do the symptoms of psychosis present themselves in teens with autism spectrum disorder? There are similarities in autism spectrum disorder symptoms in terms of anxiety brought about by changes in perspectives and thoughts. So any thoughts on that? Maybe it's a little too niche.
Well, there certainly is an overlap sometimes. I mean, I think people who have autistic spectrum disorders may have difficulty relating to other people, be able to communicate with other people. And those things overlap with people who have a psychotic episode. They may have be internally preoccupied, have difficulty relating to other people and communicating to other people, and it serves them to make them more isolated. So it's often hard if you have someone who is in the autistic spectrum and having psychotic symptoms, because you're not always sure, well, is this pure psychosis? Is it really part of the ASD or what? And it takes careful evaluation, you know, for a period of time to really understand what they're experiencing. And also it may be harder to form a relationship, a trusting kind of relationship from a clinical perspective.
Thank you. And this next one is a caregiver perspective. So maybe Doug, you can start with this one. My son is bipolar and can often be psychotic. His wife no longer has tolerance for this rapid cycling. What advice to help her and their children cope?
Well, I've been there. I understand it. I think that I have a few thoughts. One is that it's really important to give your son the space in a psychotic episode, give them some room, give them some space, number one. Number two, I think it's very, very important if there's other children, from understanding it correctly, that are involved, to just take them aside one by one or as a duo or trio, whatever they are, and just explain to them, this is what's going on, and just put it into some context so they can feel safe. It's very, very important that the others feel safe, that the person who's having the psychotic issue has some room, and and then for the adult or adults in the room, as difficult as it is, you've got to take a breath and just try to stay calm and just stay calm. Take a breath.
I think those are very good points. I would also recommend to family members to become involved with something like NAMI, the National Alliance for Mentally Ill, because they can provide a lot of support to families, a lot of information. And I think the more people can be informed about what their loved one is experiencing, it can be a little bit easier to understand and to kind of maybe be supportive of them. So this is in addition to all the things that Doug mentioned.
Mm-hmm.
So another question, can you comment on what role group therapy could play for psychosis? Maybe Rachel or Kirsten. I don't know if there's programs at McLean.
Go for it.
Yeah, no, I mean, I think so in my experience, group therapy is particularly difficult to engage individuals with psychosis in group therapy for obvious reasons. I think it can be incredibly helpful. And there are a lot of groups that are up and running right now virtually. There's a lot of partial hospital programs that are running virtually as well. So I think it's still a good idea to try to give those a try. It might actually be less threatening to try to do it virtually at first, on kind of a positive note. So it can be incredibly helpful.
I'm hoping that we at Brooklyn Minds will be able to start one of these groups, but I think it could offer a space for people to not feel alone with their symptoms, because it can be isolating if the people around you don't share similar experiences. Some of my clients describe feeling somewhat disconnected from other people. And so I think having a group where you see that there are many people in our community who, have struggled with these symptoms and, are leading, meaningful lives or connecting with people and doing things that make them feel good in the world is a space that we need to have more of.
I've worked with a lot of patients over the years who are in group therapies, and it really becomes critical to their connection, because sometimes those are the main social contacts that they have.
Mm-hmm.
And many patients who've had psychotic illnesses, unfortunately, get cut off from their families.
Mm-hmm.
They kind of burn those bridges. And so that the support they can have from group therapy, as you said, that for people who also understand what they're going through, can be an enormous support and help.
What role can peer specialists, and maybe Rachel, this one can be for you, or mental health coaches play in supporting individuals with psychosis?
I love our peer specialist movement in the city, as well as the role of mental health coaches. I think they can bring the power of relationship and connection and like building a trusting relationship with someone. I used to run an ACT team, so a mobile-based mental health team, and I used to joke that my peer specialists were able to connect and have so much, we're able to do so many more powerful things with our clients than me with my fancy degree. Just the ability to like look at someone and be like, I've been there, I know what you're going through. So, you know, and at Brooklyn Minds, we've been using the Winnicott program to connect with people before the pandemic, going out into the community and enjoying life with them, you know, traveling on the train, going to museums, you know, just using the power, the trusting relationship to help them navigate the world. And so I think that there's a huge role for peer specialists and mental health coaches right now.
I would agree. I have you know, used peer specialists a lot for a lot of years, which predates Brooklyn Minds, which is why it's not Winnicott, but Winnicott's fantastic. But I would say that it has an enormous impact because for, you know, for, in my case, my loved one, having the consistency of someone who is showing up every single day or however many days it's appropriate, that's a really great thing. There's consistency, there's a familiar face. You know, you're talking about everything from music to whatever is important or interesting, and that's a really great connection to the world. And the second thing that I'd say about that is, someone mentioned it about, you know, families and how the complexity of families and families as caretakers. I can't state enough how important it is for family members for the caregivers in a family to have peer coaches for their loved ones where they can do it, because that relief for 3 hours, 2 hours, whatever it is just fantastic. And it allows the family caregiver, me in my case, an opportunity that when I'm back on, so to speak, I'm refreshed, I'm better, I'm just better.
Yeah, I think that is a beautiful additive benefit. Thank you for that perspective, Doug. This question, is there a connection, and maybe Kirsten, you've seen this in your residential unit right now, between creativity and psychosis? Are people with psychosis being more or less artistic or musical during this pandemic?
Oh, that's such a great question.
Yeah, I love that question.
Yeah. Actually, it's making me think like that should be more encouraged right now, right? Like, what a nice way to try to connect to someone virtually as well, you know, by trying to bring some of that out. But of course, there's a well-established connection with creativity and psychosis and bipolar disorder. There's a wonderful book, I'm sure like almost everyone has heard of this. I think it's called Touched with Fire, Touched by Fire by Kay Jamison. If you haven't read it, it's absolutely amazing. It talks all about this connection. And I'm really glad this question came up, because I think it's something that we should absolutely foster more right now, especially.
And I would add to what you're saying. I've experienced that, and I think another element of that creativity is journaling. So, you know, the ability or whatever it may be, you can make this point better, but I think journaling is an incredibly powerful thing for the patient, you know, whomever, because they can't always express things in the same way, or even at the time that you want them to express it. And you know, I probably have 50 journals, books this thick, from years and years of experiencing that. So I agree.
Yep. I mean, some of the most beautiful artwork I ever have seen was on an inpatient unit paper mache mesh superheroes made out of the straw paper. It was, yeah, it was just like, where I could weep thinking about it. All right, so going back to some of these questions, in addition to medication management and reality testing, are there any specific suggestions? Are there any suggestions on specific psychotherapeutic treatment modalities that work well for psychotic disorders? And I'm going to tack on another question. So that one's treatment modalities that work well for psychotic disorders. Second question I'm tacking on is, what therapeutic approach do you use or recommend to provide therapy to patients with psychotic disorders? Psychoanalytic approach may be challenging due to the lack of insight. So what would you primarily use? CBT and other social skills?
Do you want to go?
I was just, I think that honestly, there are many great therapies and treatments out there for individuals with psychotic disorders. And I think the most important thing is to be able to be flexible and to venture into all of these different territories and to really try and find the combination of things that work for you, and to just be flexible. I think that's the most important thing.
Mm-hmm. What the research shows is what's most important through all therapy is not so much the theoretical orientation, but rather the relationship with the therapist. So it's really, I think there needs to be that foundation of trust with the therapist, and then yes, being flexible to use treatment modalities that work with the individual, because there are so many great ones out there. But if you don't at the foundation have that trust, then it doesn't really matter what you bring into the room.
Thank you. So we have about 8 minutes. So I'm going to just kind of make sure we get to the rest of these questions. How do you, and panelists, maybe 1 minute answers so we can make sure there's 4 of them left. How do you support someone in accepting their new reality after a psychotic break? Kirsten, Dr.
Yeah.
Dr. Geiszler, time.
Yeah, that's one of my favorite things to help with. I mean, it takes exactly as Rachel said. It takes to. I mean, it's individualized. It's a process that could take a lifetime. To understand. But I do think at the beginning, especially after someone has had a very first episode of psychosis, there's a lot of traumatic experiences that have happened. Maybe during an inpatient hospitalization or prior to that inpatient hospitalization, and to really just be able to open up the trauma that might have occurred during that time, I think is particularly important.
Okay, thank you. Let's see, there was one that was put in the comments. What do we do with someone who doesn't think he has psychosis, but definitely presents with episodes of not making sense?
I try to look for where they're hurting, what's bothering them. And kind of, as I said before, are they not sleeping right? Are they feeling lonely? Are they feeling anxious? Again, trying to not to kind of confront them with a problem that we might see and having difficulty understanding them, but just trying to, again, as Rachel said, the importance is having that relationship with the patient and helping them to kind of feel that they can trust their provider, and then to take it from there.
Thank you. So during a pandemic with stay-at-home orders, some treatments such as ECT and TMS might be hard to receive or not an option at all. What can be done instead? How should one re-engage after people feel comfortable to return? I would like to say, though, at Brooklyn Minds, we're very proud to have our TMS continue to still run. And it's been a effort of valor and strength by our TMS techs and clinicians. But What can be done instead if they're not available in your area? And how should one re-engage after people feel comfortable to return? Silence falls upon the panel. Dr. Geiszler?
I mean, I guess we're all silent because we all want to re-engage, and yet it seems so uncertain. When are we going to be able to? So I haven't even gotten to that step yet. I think, when we don't have the availability, well, as you said, at Brooklyn Minds, we have been providing TMS. With ECT, it's available for inpatients, but not really for outpatients anymore, which is a big loss. So what I have done, and because for years I've worked with patients who have refused TMS, have refused ECT, so I will try to pull out all the stops from a medication perspective, and try augmentation strategies and other kinds of things to help get to the best medication regimen, to help support them and help them to feel better, even if I know ECT would cure them within a couple of weeks. And besides that, I think the therapeutic support that can be given to them is really critical in helping them.
Steve, you may mention the SAINT protocol, because where SAINT is appropriate, you can talk about it, but that's certainly a way to get TMS in a shorter period of time.
Yeah, that's, I mean, there's been some work published on that where people can have intensive application of TMS over a week's time. That will take the course of, in 1 week to the course of many weeks. Unfortunately, it's not something that insurance companies are paying for yet, or is FDA recognized, but it is a promising avenue that it can sometimes be given, and hopefully ultimately will have help, because it really does have dramatic results within a week's time.
Thank you. So we have about 3 more minutes. One of the things that came up in our discussion that I think is an interesting note to end on is kind of, and Kirsten, this was kind of one of the things you brought up, that kind of during this pandemic, it's not only maybe the patients that are affected, but also clinicians are affected also. So if you can kind of speak to how this pandemic is affecting our judgment.
Yeah. I think, like, for full transparency, at the beginning of the pandemic, I was just questioning how much support I was really able to give all the people that I work with. So I know that it's having a toll on clinicians everywhere, and I think it's really important, obviously, for us to make sure that we are getting our own support. I also wanted to add that I think that I've found that kind of just bringing that into the therapeutic relationship has been really helpful. I'm sure a lot of people are already doing this, but just being more transparent and saying yeah, this is hard for me too. I don't know the answers. I don't know when this is going to be over. It's awful, right? I'm having trouble disengaging from the media too, all of this stuff. I think it just helps on a personal level to be able to deal with that stress. It helps with the human connection at the same time.
Yeah, thank you. And so I think that's a nice note to end on, kind of naming this is hard for us too. And we're all still humans, and connection is important, not just to people with psychosis, but to us, and taking care of ourselves as best we can, so we can better serve. Thank you, panelists, for being a part of this. Thank you, participants, for your great questions. And we'll see you next week.